Hello everyone, I am Dr. Deepa. Today we are here to learn about the ulnar nerve in the hand. We study the ulnar nerve under the following headings, that is the course, the branches, relations, distribution and the applied aspect regarding the ulnar nerve. To begin with, the course of the ulnar nerve. The ulnar nerve is the nerve which is seen as a continuation from the forearm. The ulnar nerve in the forearm, that is the front of the forearm, the anterior compartment of the forearm, enters the palm by passing superficial to the flexor retinaculum. Yes, this is the flexor retinaculum over here. We can make out the ulnar nerve. The ulnar nerve leaves the forearm by passing along the medial border of the forearm, runs superficial to the flexor retinaculum along with the ulnar artery to reach the palm. So this is how the ulnar nerve is related to the flexor retinaculum. This is the highlighted picture, enlarged picture, where we can make out the flexor retinaculum, the structures superficial to the flexor retinaculum along its medial end. So the nerve is accompanied by the ulnar artery where it divides into its two superficial and the deep branch in the palm. So this is how the ulnar nerve enters the palm. Moving on to the branches of the ulnar nerve. Once the ulnar nerve enters the palm by passing superficial to the flexor retinaculum. This ulnar nerve divides into its two branches, that is the superficial branch and the deep branch. It divides into its superficial branch and the deep branch. Superficial division and the deep division. So these are the two terminal divisions of the ulnar nerve. So the superficial division later on by entering the palm lies deep to the palmaris brevis and the palmar aponeurosis, and it is seen to divide into its two branches, that is the medialmost branch is called as the proper palmar digital branch, proper palmar digital branch, whereas the lateral branch is called as the common palmar digital branch. So these are the two branches of the superficial division of the ulnar nerve. The proper palmar digital branch is seen to supply the ulnar side or the medial side of the little finger. It supplies the medial side of the little finger. So this is about the distribution of the proper palmar digital branch, whereas the common palmar digital branch supplies the adjacent sides. It supplies the adjacent side of the little and the ring finger, adjacent sides of little and ring finger. So this is about the distribution of the superficial branch of the ulnar nerve. I repeat, superficial branch of the ulnar nerve divides into two branches, that is the proper palmar digital branch and the common palmar digital branch. The proper palmar digital branch ends by supplying the medial side of the little finger, whereas the common digital branch ends by supplying the adjacent sides of the little and the ring finger. So next is the deep division of the ulnar nerve. The deep division of the ulnar nerve later, once it enters the palm, is seen to run between the two muscle, that is the abductor digiti minimi and the flexor digiti minimi. It is seen between the two muscles, that is abductor digiti minimi and flexor digiti minimi. Later it enters the deeper portion of the palm by passing or piercing deep to the muscle, that is opponent's digiti minimi. Opponent's digiti minimi. Once it pierces the opponent's digiti minimi and enters the deeper portion of the palm, the nerve runs along the nerve is seen to run along the concavity. It runs along the concavity of the artery, that is the ulnar artery. It runs along the concavity of the ulnar artery and later ends by supplying, it ends by supplying the muscle, that is adductor pollicis. Adductor pollicis. So this is about the fate of the deep branch. So the deep branch of the ulnar nerve enters the palm and later it is seen to run between the two hypothenar muscles, that is the abductor digiti minimi and the flexor digiti minimi. Later the muscle opponent's digiti minimi pierces the nerve, ulnar nerve, deep branch of the ulnar nerve. Once the ulnar deep branch of the ulnar nerve pierces the opponent's digiti minimi muscle, it runs along the concavity of the ulnar artery and it ends laterally by supplying the muscle adductor pollicis. So this is about the fate of the ulnar nerve. So this is at the end about the branches of the ulnar nerve. So the ulnar nerve in the palm has got the superficial branch and the deep branch. Superficial branch again has got two digital branches, that is the proper palmar digital branch and the common palmar digital branch, whereas the deep branch gives lot many muscular branches during its course and ends by supplying the adductor pollicis muscle. So this is about the branches of the ulnar nerve. So in this picture we can make out the ulnar nerve entering the palm. As I have already discussed just now, the two branches of the ulnar nerve, that is the superficial branch and the deep branch. The deep branch leaves the superficial portion of the palm by passing between the hypothenar muscle and piercing the opponent's digiti minimi muscle, and the superficial branch is seen to supply the medial 1.5 finger over here through its digital branches. So this is again the atlas view showing the ulnar artery. So here we can make out the ulnar artery which is accompanied by the ulnar nerve. This is this flexor retinaculum. So we can make out the relationship of the flexor retinaculum with that of the ulnar vessels and the nerves. Once the ulnar nerve enters the palm, it divides into the deep and the superficial. We can make out the fate of the superficial branch over here. The superficial branch seen dividing into its common digital branch and the proper digital branch to supply the entire little finger and the medial half of the ring finger. So it also gives one communicating branch to the median nerve over here. So this is the atlas picture showing the deeper dissection of the palm, visualizing the deep branch of the ulnar nerve over here. The deep branch of the ulnar nerve, once it enters the deeper portion of the palm by piercing the muscle, that is the opponent's digiti minimi, it is seen to hook around the hamate, which is the carpal bone, and later it runs along the concavity of the deep palmar arch along with the ulnar artery, that is the deep branch of the ulnar artery, and ends by supplying the muscle adductor pollicis. During its course, this deep branch gives muscular branches to all the interosseous muscle, that is the palmar interosseous, the dorsal interosseous, as well as the two lumbricals, that is the medial two lumbricals, along with the hypothenar muscles also. So the deep branch of the ulnar nerve supplies the muscles. Here the muscle supplied by the, that is the motor supply. So the ulnar nerve has got the motor supply as well as the sensory supply. So the muscles supplied by the ulnar nerve are the hypothenar muscles, number one. So it supplies the hypothenar muscles it supplies the muscle that is the adductor pollicis of the thumb. It supplies the third and the fourth lumbrical muscle. It supplies the third and the fourth lumbrical. So these are the muscles, and also all the interosseous muscle, all the interosseous muscles of the hand. Interosseous muscles, that is the palmar interosseous. In total there are 7 interosseous muscle. So the palmar and the dorsal interosseous, all these muscles are supplied by the ulnar nerve. I repeat, the motor supply of the ulnar nerve. The ulnar nerve supplies the hypothenar muscles, that is the flexor and digiti minimi, the opponent's digiti minimi, the abductor digiti minimi. It also supplies the adductor pollicis. It supplies the third and fourth lumbrical and all the interosseous muscle, including the palmar and the dorsal interosseous. So these are the muscles supplied by the ulnar nerve. When we talk about the sensory supply, the ulnar nerve has got the sensory supply also. So the sensory supply mainly contributed by the superficial branch. The sensory supply mainly contributed by the superficial branch as discussed previously. So this sensory, so the ulnar nerve supplies the medial 1.5 finger along with its adjoining palmar portion, medial 1.5 finger. So these are the supply or distribution of the ulnar nerve. So ulnar nerve has got the sensory supply, it has got the motor supply. Motor supply is all the muscles as discussed just now, and sensory supply is by the superficial branch which supplies the medial 1.5 finger. The ulnar nerve is also seen to supply one important muscle, that is the cutaneous muscle, which is the palmaris brevis. So it also supplies the palmaris brevis. Palmaris brevis muscle, which is seen in the superficial plane along the medial border, is also supplied by the ulnar nerve. It is supplied by the superficial branch of the ulnar nerve. So this is about the distribution of the ulnar nerve in the hand. So this is the picture showing the relationship of the ulnar nerve with that of the ulnar artery. We can make out here the ulnar nerve entering the palm along with its branches, the superficial branch giving the digital branches which runs along the digital branches of the ulnar artery. Here this is the view showing the dorsum of the hand, where we can make out the ulnar nerve giving branches to the dorsal portion of the hand, where here also it supplies the dorsum of the medial 1.5 finger. So this is again the relationship of the ulnar nerve seen along with the ulnar artery. So the digital branches of the ulnar nerve runs along the digital arteries as well. So this is next is moving on to the relations of the ulnar nerve. So when we talk about the ulnar nerve, so ulnar nerve is superficially related to the flexor retinaculum before entering the palm. In the palm, the ulnar nerve is superficially, or it is related above to the muscle palmaris brevis as well as the the palmar aponeurosis, and it is always related to the ulnar artery along its course. In the deeper portion, the deep portion of the ulnar nerve is related to the interosseous muscles and the metacarpals. So this is about the picture showing the distribution of the ulnar nerve. As I have already told, the ulnar nerve supplies the medial 1.5 finger along with the adjoining portion of the palm along its dorsum as well as the palmar aspect. Again, the colored picture showing the distribution of the ulnar nerve. So the blue shade represents the area supplied by the ulnar nerve. Lastly, moving on to the applied aspect or the clinical importance of the ulnar nerve. The ulnar nerve is also called as the musician's nerve. Yes, ulnar nerve is called as the musician's nerve, or the nerve which is responsible for the finer movements of the hand, because this ulnar nerve is the nerve which supplies the major muscles, the smaller muscles of the hand, which is responsible for the fine muscular movements. So hence it is called as the musician's nerve. So the paralysis or the injury of the ulnar nerve leads to the paralysis of all the muscles supplied by the ulnar nerve. So there is wasting of the hypothenar eminence, and we can also make out the paralysis of the adductor pollicis also. There is something called as claw hand deformity, wherein we can make out with which is a condition seen as a result of injury to the ulnar nerve. So this is the picture where showing the result of the injury of the ulnar nerve. This condition is the partial claw hand. I say it as partial because only the medial half of the hand is affected due to the injury to the ulnar nerve as well. So we can make out the wasting of the hypothenar muscles here. Hypothenar eminence wasting is seen. Along with that, there is extension of the interphalangeal, there is extension of the metacarpophalangeal joint and the flexion of the interphalangeal joints of the medial two fingers, that is the little finger and the ring finger. So this is called as the partial claw hand. The condition called as in the complete claw hand is also seen. In case of complete claw hand, there is the claw hand involving all the fingers, that is all the four fingers are involved, which is a result of injury of the ulnar nerve along with the median nerve. So this is about the claw hand deformity. In case of the ulnar nerve palsy, the patient is unable to spread out the fingers due to the paralysis of the dorsal interosseous muscles also. So the power of adduction of the thumb is lost. There is flexion of the ring and the little finger is also seen to lost. So this is about the clinical importance of the ulnar nerve. Thank you.